Many nursing students try to memorize diabetes and then forget it in exams. But what if I told you that you could actually understand it and never forget again? Diabetes is actually one simple problem. Glucose cannot enter the cell. And because of this, glucose builds up in the blood. As usual, let's take a look at the normal. Once we eat food, it is broken down into glucose. So you eat food and it is digested. The end product is glucose. This glucose is released into the bloodstream and it's just there waiting. The pancreas secretes two hormones, insulin and glucagon. So insulin decreases blood sugar, while glucagon increases blood sugar. Now, insulin acts like a key that allows glucose to move in from the bloodstream into the cells. But in diabetes mellitus, this system breaks down. So it's either there is no insulin being produced at all. So the cells of the pancreas that produce insulin are probably destroyed and there is no insulin at all, like in type 1, or that the insulin is being produced, but the cells are not as responsive to insulin. So normally, the cells are very responsive once insulin is there, opens the gates, and glucose moves in from the bloodstream into the cells. Now, in something like type 2 diabetes, this responsiveness is not as it used to be. Regardless of which type, it leads to glucose being unable to enter the cells. And instead, what it does is it builds up in the blood. So digestion continues to go on. Glucose is being released into the blood, but unfortunately, it cannot enter the cells because of the insulin problem. So it just continues to build up in the blood. Now, the body tries to remove this excess glucose through the kidneys. Normally, once the kidneys sense glucose in the urine, they will reabsorb it back into the blood, which is why in a patient that does not have diabetes, once you test their urine for glucose, you will not find. Now, in diabetes, there's so much glucose in the urine, the kidneys cannot reabsorb all of them. It will reabsorb as much as it can, and then it will just let the rest pass through. Therefore, there will be glucose or there will be presence of glucose in the urine, and this is called glycosuria. That is why once you test a patient who has diabetes, once you test their urine for glucose, you would see the presence of glucose. This is how it occurs. Now, with glycosuria or glucose being in the urine is now more concentrated than it normally is. Therefore, the body pulls in more water from the cells into the urine to try and balance the concentration of the urine, leading to frequent and excessive urination. You see how when you drink a lot of water, you urinate a lot. It's the same thing that applies. There is now more water in the urine in an attempt to balance the glucose. Therefore, the body must get rid of this, leading to excessive urination. This is what is known as polyuria, and it is the first P. When you hear about 3 Ps in diabetes mellitus, this is the first P, polyuria. Now, with constant urination, there is so much water going out. With all that excessive urination, the body naturally becomes dehydrated as a result. Once there's dehydration, the brain says you need to drink more. So it makes the body thirsty so that you can replenish all that water going out. Now, because the urination is going on all the time, excessive urination constantly, it means the person is going to be constantly thirsty to try and replenish the water that is going out. And this constant thirst is the second P in diabetes mellitus, and it is known as polydipsia. So there is now glucose in the bloodstream, but unfortunately, the cells cannot access it. It's not that the glucose is not available, it's that the barrier cannot be opened because of the absence or lack of response to insulin. Therefore, the body says, we're not getting this glucose. It means we're probably starving. We're probably not eating well. So we need to eat more. So it triggers hunger so that the patient can eat more. And that is why the patient is constantly hungry, because the body thinks it is in a starvation mode and it is trying to eat more so that it can make glucose accessible to the cells. Unfortunately, that is not the problem. So as the patient is eating more, it just keeps getting converted to glucose and it keeps staying in the blood. So the body constantly continues to trigger hunger in a bid to try and get glucose to the cells. And this is the last P of diabetes mellitus, polyphagia, constant hunger. Now, there is no glucose in the cells, therefore no energy, because the cells need glucose to convert to energy to carry out their day-to-day activities. They are not getting glucose again, so they don't have any energy, leading to the patient always being tired, which is fatigue. You see how we've connected the signs and the symptoms. Now, what happens if this is left untreated? If this high blood sugar remains unchecked, high blood sugar being constantly in the blood vessels damages the blood vessels. When it happens to little blood vessels like the ones in the eye, that is where you see diabetic retinopathy. And that is why diabetes can lead to blindness, because it causes retinopathy. It also damages the kidneys, and that is nephropathy. The blood vessels in the kidneys, once they start getting damaged, the kidneys start to shut down. That is nephropathy. And it also damages the nerves, and that is neuropathy. You could see in patients with diabetes, sometimes they are not able to feel their extremities, so their hands, their toes, their legs, they're not able to feel it, which is why when they have an injury, sometimes they don't even know that they have an injury. It is because of the neuropathy. And when they have this injury, it takes time to heal, because what? The blood vessels have already been affected. The blood vessels are getting damaged. And as they're getting damaged, there is even slower blood flow to the area of injury, leading to diabetic foot ulcer. You see why diabetic foot ulcer takes time to heal, because not only are the blood vessels damaged, it also damages or brings down the immune system. So the things that actually help an injury to heal faster, like a good amount of blood supply and high immunity, they are already not. Therefore, diabetic foot ulcers get necrotic very quickly. They have a pungent smell as well, and they take time to heal. If you forget any other complication, don't forget nerve damage, neuropathy, retinopathy, and kidney damage, nephropathy. Don't forget this. You can also add diabetic foot ulcers, but for exams, when you talk about pathophysiology, you don't need to include all the complications. Bringing it all together, no insulin or insulin resistance will lead to glucose being unable to get to the cells. Therefore, it builds up in the blood, spills into the urine, leading to glycosuria. Glucose draws water, and that causes polyuria or excessive urination. Excessive urination will lead to dehydration, leading to constant thirst, known as polydipsia. Now, the cells are starving because glucose is available but unable to get to them, so it triggers constant hunger to try and get glucose to it, leading to polyphagia. No glucose to the cells means no energy, hence patient has fatigue. If this is left untreated, it would damage the nerves, which is known as neuropathy. It would damage the kidneys, nephropathy, and it can also cause blindness. It can damage the eyes, known as retinopathy. That is the summary of the pathophysiology. I've been able to show you the normal and how this abnormal leads to these signs and symptoms, and how it connects to the complication. If this video helped to make things clearer for you, then you are going to love the next video. We will be differentiating between diabetic ketoacidosis and hyperosmolar hyperglycemic state. These are two life-threatening complications of diabetes type 1 and diabetes type 2. In the next video, we will be looking into this properly. The essence of this channel is to simplify these things for you so that you actually understand, and regardless of what exams you're writing or in the clinical setting, you'll be able to remember this effortlessly. Don't forget to subscribe. Remember to share this video to someone who needs to understand the disease process of diabetes mellitus. And remember to like the video as well. Leave a comment and let me know how I've helped you. Thank you so much for watching, and I will see you in my next one.